So we're going to be removing her spleen. She has a mass on her spleen, and about a week or two ago, she actually had bleeding into her abdomen from that mass. So we're going to remove her spleen, and with that, remove the mass and the risk of bleeding in the future. And hopefully that'll also tell us if this is something that is benign and hopefully not going to be a problem for her in the future versus something that's cancerous and going to end up coming back to haunt her. All right, you ready to roll?
Yeah.
Okay.
It's in? Emily?
Yeah, why is it red right there? Like, why is it all, that's weird.
I put it on, we were on there's two ports for your
Oh,
thermometer.
okay.
I put it on the second one just
I
to
see.
try and change everything. It's red right now because its standard is between 104 and 96.8.
She just really cold.
Yeah.
Yeah, we're trying a new thermometer to verify.
Hammer,
Yeah.
are you able to grab me like a rectal one with some lube on it, and I might try to go in the back and see if I can grab it.
I also have your 15 blade out. Yeah, I was like, look at all the things, so I put which one is it?
Mom was fixated a little bit on the fact that this is going to take 45 minutes. So now I'm a little bit pressured. I feel like I have to take 45 minutes.
How'd she get that number?
I mean, I think I said it to her. Like, usually they take about 45 minutes.
Yeah.
But now this is supposed to be the one that, like, something's weird. And,
We're like in here for an hour and a half.
yeah. And in the meantime, Mom's worrying.
I
And
didn't
Mom
know
out.
where, I don't want to just set a thing.
Thank you.
Yeah.
Do you want the golf course?
What? Do you want them?
No, it's okay.
Oh,
Thank you.
I have them out.
Thank
The
you.
Alright.
ones with other stuff if you need it.
Okay.
Right over there.
Thank you, sir.
No problem.
Whenever you get a sick, do you mind rubbing some saline?
Can that tool cut your finger at all?
So, yes and no. If I didn't have gloves on, yes, it absolutely would.
Rubber. Okay.
Because I have gloves on, it kind of acts like tires on a car. So if you stay in the car and you don't touch the ground, the lightning won't electrocute you. But if you touch the ground, then you're gonna feel it. So as long as my gloves are latex, so that my gloves are gonna protect me. But if I have a hole in my gloves, you better believe I'm gonna feel it. And it is still a little hot, but it doesn't actually burn me.
I'm guessing that's happened to you at least once. Yeah.
It leaves a memory.
Okay.
Yeah.
Did you grab that golf set?
Did I what?
Never mind, I'll let you do
And
that.
so that this is a slightly different type of electropowder. This is something called ligature. And so instead of being a pencil like this, where the electricity goes into the dog and then out the ground plate and back to the machine, it just goes between the two jaws. So it doesn't go to the rest of the body, so it's a little bit better when you're working close to like spinal cord or things like that. But in this case, the nice thing about it is that you hear the beeping. So that's actually measuring the electrical impedance as the electricity goes through the tissues. and is actually testing to see when the tissue is melted enough that it's going to be sealed and not bleed, versus no, we need to keep going and it's not ready yet. So it'll actually tell me if I let go too soon. It yells at me and says, "Hey, we're not done yet." And so I have to wait until it tells me we're done. And then it's got this little scissors in the middle so that it actually cuts the tissue in one go. So I know I'm cutting where I've sealed.
Maybe for the rest of her ketamine, she was going like this with her paws.
Okay.
And I can tell she was going.
She's ready for it?
Yeah.
Okay. Thank you, ma'am. So this lacy stuff, this is the omentum. So it's this like fatty mesh that's in the abdomen that acts like the band-aid of the body. So before, when this mass bled, the omentum went and glommed onto it to try and help it stop bleeding. But now that means now we have to remove a little bit of that omentum with the mass itself, because it could start bleeding if we try to just peel it off.
Yeah, I'm just gonna try to get a rectal real quick. Just to see. We also need to get some. Do you mind grabbing me some warnings just to get ahead of it?
Does she have like socks on and stuff too?
Does she have what?
Socks on.
No, that's a good point. I can have to go down.
So now this is the mass. So this is a normal spleen over here, and then you can see this is the part. It's like a baseball shaped mass. And this is where all the blood vessels come in normally that we just ligated off.
Let's do 3 for, just grab me 4 just in case.
So almost every time we do a splenectomy, we also do a liver biopsy for 2 reasons. One reason is that if it is cancer in the spleen, a lot of times the first place that it will spread to is the liver. The other reason is that most of the time we're removing the spleen in older dogs who have liver enzyme elevations anyways. And so if we're here, now is a great time to be able to take a biopsy and know a little bit more about what their liver's doing and if there's anything else that we need to address and treat in the liver.
Are you taking another spot?
Yeah.
Do you want that one to go with the same one?
We can, yeah.
Ooh, that guy was hot.
Oh, there's our little adrenal mass from.
Can I talk through your video?
You see that? It's fine with me. Is that fine with you? Good. So adrenal mass right here. So
Oh my gosh.
there's the kidney.
Yeah.
This should be literally about the size of a peanut. And you can see it goes. It's almost the size of a golf ball. See, this is the liver mass. There's the ultrasound. Okay,
Oh, okay.
and then there's the pancreas. Pancreas looks pretty happy. And we just trying to look at.
So ultimately, she just wanted to focus on the spleen, not the liver and any of the other.
She wanted to try and make this as quick and low complications as possible. This is lymphangiectasia. You see the white?
Yeah.
So those are the lymphatics. So you see the normal blood vessels,
Yeah.
but then the white blood vessels are the lymphatics.
So normally we don't see that.
Correct.
And the reason for that being very white would be because it's fighting the mass that they have going on, or?
All doesn't have anything to do with it. Could be that she has some like underlying IBD. Could be that whatever her last meal was really fatty and she's still like processing that. Could be a lot of different reasons. We gotta go. Can you actually grab a 3cc syringe and a 22 gauge needle?
Yeah.
Before you dive down there so that I can get that urine sample? I'll try to anyway.
You need a long one or a regular needle is fine?
Let's do a long one. I think go back super far.
So what's going on now?
So this is anytime we go into the belly, we want to look at as many of the organs as we can because that's always going to be the most accurate way of trying to assess things. So this is all for intestine. I just kind of leafed through all of it to make sure there wasn't any masses, foreign bodies, anything that might have been missed or changed from her last ultrasound exam. And then she has had some, she's had some urinary tract infections in the past, so I'm just gonna get a quick sterile urine sample so we can try and figure out what's going on with that. If we can get any urine out of here.
Well, she was out pre-operatively. She kept having some urinary incontinence.
Well, and I remember when she came in for her recheck, we couldn't even get a sample because her bladder was so empty. There we go. Just gotta get away from the microphone now. You can go ahead and give this a Vaseline,
Okay.
and then if we can put that into
White top.
a white top, and do they want to culture it with it too, or just the white top?
I always thought it was just the white top.
But her bladder looks smooth. So yeah, we just want to check everything while we're in here. Because if there is anything else that we need to do to intervene, now's our chance. Or take biopsies to get more information about things. There's our other kidney. There's our little normal adrenal. She's got some kibble in her stomach. Feels interesting. And then she also she has that form of mucocele, but her gallbladder actually is very normal.
So I was like, it doesn't look crazy.
Yeah. Can you give us a little bit more warm saline and we'll try and warm her up from the inside out too? And then I'll grab some saline from you as well. Or some suture, sorry.
Okay.
I'll take this guy.
What pictures do you want?
Can we get OT PDS 3-aught monochrome, 3-aught 9-1? You can give us the rest of that bottle.
need to get a better feel of this knee while she was asleep?
Huh?
Do you need to get a better feel of this knee while she was asleep? You're good, okay. We're all done. We're gonna wait. Are we gonna reverse her? That's hurt. Pretty hard.
You look okay?
I think so. I mean, it's just like it's whiting up like crazy because
Bone.
the
Or
bone.
the
But I
metal
think
on
we
it.
got her as straight as possible.
Okay,
And it's the best. It's as much as straight as we can get that leg, and as easy as we can get the legs.
okay.
So
No contrast enhancement within the bone that you can tell, or you just can't see the bone?
I can't tell with the because it lights up with and without contrast because of the stuff. So my eye can't tell.
And we got chest, belly, and whole legs.
Mm-hmm.
Okay,
Backwards.
backwards.
Yes.
Okay.
To reconfirm with you,
Her
we
knee
have-
did pop when I was positioning her, and I wasn't doing anything like strong, just so you know.
Does it pop again if you move her again? Not really.
I didn't like it the first time.
Okay. Crazy.
10 gauze, 5 locks.
Including the ones I threw over here?
No, I'm just saying in total. We haven't counted yet.
Oh, yes,
Yeah.
we should have 10 in, or 20 and 5. 10 are in here, and then there was 10 over here.
1, 2. You have over there.
We have 1 lap pad over here.
4 and a lap pad.
Just a lap pad.
Oh, just a lap pad.
And this Emily stole some.
Okay.
I didn't take any.
Are we missing my gauze?
2, 4, 6,
Her 10 roughly is 96.1.
9. We're missing 1 gauze.
Can you look underneath that lap pad, make sure I didn't drop a gauze too?
On that end.
That one gauze, there's that gauze too.
We're just missing 1.
There's a gauze right here.
Okay, sweet. That makes 10.
What do you have on your treatment plan for her?
So far, I just have her, vitals. I was gonna start that around 6 o'clock.
Sure.
And then, her GABA traz is on there, GABA Q8, traz Q12.
And we started those at what, like 8 or 10 o'clock?
Yeah, so it was, I think, GABA 9 or something like that. That's all I have so far, and then like her fluids. I was gonna keep her on this lidocaine CRI at half strength, during her recovery until it runs out.
How long would that be?
It'll probably be like an hour and a half by the time we get here. And then I was gonna DC the ketamine CRI.
Yeah, agree.
And then obviously if she's throwing any VPCs out there, then we'll turn back for, refill her lidocaine CRI and turn her back on that.
Yep. And
As
you've got
far
the
as-
continuous CCG on there?
Yes, that's on here. And then as far as pain control, do you want me to just, do you want to stick with the fentanyl?
She's still on fentanyl CRI, yeah?
She's not on fentanyl CRI, but she did get it for her infection, her pre-med.
Okay. Well, whatever she got as her pre-med is probably gone. So we need to give her some type of opioid coverage for a little bit, whether we give her, we could do a dose of hydro, or we can do a ketamine CRI, whatever your preference is.
Okay.
But we can do something, at least for this first little bit, to keep
Yeah.
her comfy.
I'll do a hydro dose at the 0.05, right? Or sorry, 0.5.
0.05.
0.05, yes.
Yeah. And we can do Nocita for her too.
Okay.
What would her dose be?
This poor kid's skin.
Be about 4 mils.
Okay.
You want me to dilute that?
Yes, dilute it up to 8.
Okay. Shay, can you look at me one of those Nocita bottles out of the fridge? If there's an open one, preferably. It'll be probably down in the drawer, the bottom drawer. Yeah.
The ones that you were doing earlier, you said were very cruciate. Are these different?
So they're the same like cruciates that you do in the skin. They're just upside down so that the knot actually flips under the incision to the subcutaneous tissue. So it's less likely for the knot to stick out of the incision. So I'll do that a lot when I'm closing like the subcu space, because there's not usually a ton of space to hide the knot, and I don't want it to poke out through the skin. Makes sense?
Mm-hmm. No, they're close. So I need more of the Dean ones. Ink.
I don't think that's user error. I don't think that's me blaming on the scissors.
It would help me like angle, you
Oh,
know?
that is. And you've got the PCB on there for an hour after she wakes up, right? So
Yes.
you're gonna, like, whatever time that is again. Apparently I got my timing completely wrong. I told you guys to go slow so I'd have time to do that fine consult.
Mm-hmm.
And then she came out and was like, okay, we're done. Like the moment you guys were ready in here. Like, oh, I was not expecting you guys to talk for that long. So, yeah.
So Pine's completely done?
Well, I still have to call and talk to her about
Yeah.
like what she wants to do.
Uh-huh. What are the options?
Kind of which one?
The jaw maps,
Is
The
like
phone
surgery
console
to
kit.
remove
the
the
phone
mass?
console kit. Huh?
Are you gonna offer like chemo, or would you, is it something you'd surgically remove?
Yeah, she wouldn't need chemo. It's not actually like a malignant tumor, it's a
Yeah.
benign tumor, but it is eating away at her jaw, and there's no way to remove it without removing a part of her jaw. So I don't know if that's something mom's gonna wanna do or not, but
Yeah.
that's the conversation we gotta have. She could try and go see if, radiation would kind of make it stop growing. Or like it doesn't seem to be bothering the dog at the moment, but I don't know how long before it would potentially bother the dog. She's a pretty cute little girl. They just adopted her this spring. They found her as like an adult dog.
Really?
They found her like wandering or at a shelter.
I'm not sure on that. I just know that they only rescued her like a couple months ago. Wouldn't be surprised if they found her wandering because somebody
kind of
didn't
dog
want
is
to
she?
deal with this. She was like a hound mix. She's a sweet girl.
It's sad that a lot of people do discard their pets whenever they don't want to deal with something that's
It is.
costly.
And like part of me gets it, like, you know, people can't always afford to do the things that their pets need when they get sick, and I get that. But I think that whether it's our feeling as a profession or whether it's people's individual thoughts of like not wanting to at least palliate things and still have that be part of their family and take care of them.
Yeah.
Like, take care of them doesn't always mean, you know, give them $10,000 surgeries and all that kind of stuff. Sometimes taking care of them is just keeping them comfortable while they get old and eventually have to say goodbye. But I don't know, I couldn't imagine giving up my pet just because they were sick.
No.
Also, I couldn't imagine giving up my pet just because I had to move and like, I'll find a place that would take a pet, you know?
No, when I was moving from like Florida to Texas and all over, Maui was just riding it out with us.
Yeah,
Like,
exactly.
and even there's times where like when I first moved to Austin, I had like $500 in my pocket and that was about it. And I'm like, well, Maui,
We're gonna share the
we're gonna
McDonald's
yeah,
hamburger.
yeah. And it's like that's your pet. Like, yeah, I don't understand it either.
But, I mean, I think that's a relatively new thing. Like 100 years ago, dogs, you know, were for herding cattle and they slept outside and they ate your leftovers, right? You didn't have canned dog food and boutique hair salons for dogs.
Yeah.
That's definitely,
Acupuncture.
yeah.
All that.
So, thank you, ma'am. There's a couple rescues out there that like specifically will rescue geriatric dogs to like, you know, that have been surrendered because of bad news.
If I won the lottery, I wouldn't tell anybody, but you'd know.
Because you would open a rescue.
I would have geriatric animals. That's what I would have. They're just so sad.
Yeah,
Like, and they still just want to be loved like puppies.
definitely, yeah. Okay. All right,
All right.
that's it.
Yes.
Okay.